Good morning. I am Maura Rosenfeld, Chief Business Officer of MindUP, the Digital Health Incubator. MindUP is a partnership of IBM, Medtronic, Tango Venture Capital, Impact First Investments, and Rambam Hospital. Today, we are going to take a look at the challenges facing digital health startups and how the Israel Innovation Authority Incubator Program can help. As a digital health startup based in Israel, you typically will face challenges reaching your target market abroad while you struggle with the limits of your budget, information, and your network. Overcoming these challenges is critical to success. Although there is currently a hold on live meetings, distance can be more than physical. Different cultures and different market dynamics can leave you far from where you need to be. You'll also probably find yourself with a very limited budget, which you need to stretch to cover product development, clinical studies, regulatory and reimbursement strategy, and business development. You also probably find yourself with a lack of information to fully understand the needs and value proposition for each stakeholder involved in your target market. These stakeholders include payers, providers, patients, and caregivers. Getting the right information about their needs lays the foundation you will need to achieve product market fit and to build a successful go-to-market strategy. Naturally, you also need to create a broad and strong network of people in the industry that will help you find champions for your product, strategic partners, and investors. For this reason, I decided to give this talk in English, with the hope it might reach a larger audience of people outside of Israel who might be able to help our portfolio company. Before we dive into all of these topics, please allow me to give you an overview of the IIA Incubator Program and the process you will go through to join an incubator. I will talk about how we do things at MindUP, but most incubators have a similar process. The goal of the Incubator Program is to support entrepreneurs with innovative technological concepts at the initial stage of product development, allowing them to establish startup companies and helping them to reach a significant fundable milestone needed to raise more funds. The Incubator Program has evolved a long way from its original inception in the 1990s to create jobs for new immigrants from the former Soviet Union. Today, like MindUP, the incubators are backed by significant corporate partners and operated by highly professional teams that provide strong support for their portfolio companies. The Incubator Program provides each company with a budget of 2.5 million shekels for a 2-year period. 85% of the budget is granted by the IIA, and 15% matching funds are invested by the incubator. The IIA does not take equity in the company. Instead, it receives royalties on sales and proceeds from any exit event. The incubator, as required under the program, does take an equity stake in the required range of 20 to 50%. As you can see on this slide, joining an incubator means you're getting your pre-seed investment from the incubator. Accordingly, you will go through a selection process, first with the incubator, before you apply to the IIA for funding. If you take a look at step 1 on the side, let's talk about that for a minute, screening and due diligence. Like other incubators, MindUP has a pretty thorough screening process. Once we decide we want to take a project through due diligence, we invest a lot of time and effort together with the entrepreneurs. We dig into the market by talking to relevant shareholders. Our CTO does a deep dive on the product and IP with the entrepreneurs. We get to know the team and evaluate their strengths and weaknesses. In our process, the team meets with the representatives of each partner in the investment committee, all senior executives. The entrepreneurs have the chance to present their project and get direct input from them. After this series of meetings, the team formally presents their project to our internal investment committee. This is the common practice in all incubators. As you can see, even if a project does not get approved by investment committee, the entrepreneurs come away with valuable information, new contacts, and a better understanding of what it will take to get to market. Once the project is approved by the investment committee, the team prepares the IIA application with our assistance. Once the application is submitted, the IIA assigns examiners to review it. Typically, the team meets with the examiners within a few weeks. The examiners then submit their report, and the IIA committee reviews the application and the report together and decides if it will approve the project. This typically happens about 2 months after submitting the application. Now that you have a better understanding of the incubator program process, let's dive into how joining an incubator can help you meet the challenges of being a digital health startup based in Israel. As I mentioned, incubators today are backed by strong corporate partners. At MindUP, we have an alliance of strategic partners that includes IBM, Medtronic, Tango, and Rambam. Our shareholders are more than investors. They provide our entrepreneurs access to invaluable field-specific resources, expertise, and connection. For example, IBM can bring expertise in AI and data analytics, Medtronic's advice on go-to-market strategy and various aspects of product development. Rambam provides subsidized clinical studies, and Tango can assist with understanding business models and go-to-market strategies. In a minute, we will take a look at how much of a difference they can make. Incubators also provide strong support in many other ways. Each company gets an office for the incubation period. At MindUP, we also have a workshop for companies that need to do testing on site. Naturally, the incubator also provides legal, accounting, and administrative services. Being in an incubator also provides you with a community of peers that are going through the same process of building their startup. We have entrepreneurs with varied backgrounds, ranging from first-time founders to those who have already founded and sold a company. They have a variety of technical and business backgrounds, and they freely share ideas, contacts, and support with one another. Although I'm biased, I think one of the most important factors of being in an incubator is the technology and business guidance from the incubator team. When you look at the management teams in incubators today, you find a wealth of experience and industry contacts that most startups cannot obtain on their own. At this point, you're probably thinking, that all sounds like some nice marketing hype for incubators, but what really happens? So let's take a look at Antishock, one of our portfolio companies, as a real-life example. Antishock is developing a non-invasive fluid management device to aid physicians in optimizing fluid dosage for critically ill patients. They are monitoring microcirculation of fluids under the tongue. This device is meant for ICU patients that are usually intubated and in a clinically induced coma. This is the first startup for the company's founders. 2 of the co-founders are engineers. The third is a doctor, but he specializes in internal medicine and not in critical care. The company's initial product idea was to use this device. It would have been placed on the lower teeth and had a sublingual sensor going across the teeth fitting. The company needed to assess the product market fit. How well would the product they want to bring to market provide a viable and desired solution for a real need? On their own, the founders were lacking the contacts and market reach to carry out this task successfully. They also needed to better understand the value proposition they could bring to customers. This is when the incubator picked up the ball. First, our CEO asked a personal contact, who was a former nurse and now a healthcare consultant, for her input. She pointed out some key factors. One is that ICU nurses need to carry out oral care, cleaning the mouth, every few hours to prevent infection. How easy would it be to remove and replace the device to do this? Another important factor is the intubation tube that is in the patient's mouth. How would the device fit in the mouth with it? Next, we turn to our partner, Medtronic. The Antishock team had access to senior executives in the company who specialize in ICU care. These executives basically ripped apart the product idea for exactly the reasons I just mentioned. Now, this may sound discouraging, but it actually was the greatest service they could do for the company. The team now had the right inputs they needed to redesign the product to accommodate the needs of the customer. As you can see here, the product now sits on one side of the mouth and fits easily over the teeth. This means it will not interfere with the intubation tube, will not disrupt the workflow of oral care for the ICU team. The team also needed to get to a better understanding of the value proposition. Once again, Medtronic pitched in and gave the team access to senior staff in the reimbursement department. They gave the team a very clear overview and pointed out that the value is not just being able to save days in the ICU, but overall days of hospital stay. This advice prevented the company from going down the wrong track and doing a clinical study that would prove the wrong outcome. I must confess, I have worked in many startups, and I was a bit jealous that I never had access to help like that. In addition, our incubator also has a strong relationship with the University of Michigan Law School of Business. Antishock participated in a project where a team of MBA students carried out an in-depth analysis of the company's product offering, value proposition, and go-to-market strategy with impressive results. The incubator's network also enabled the team to reach key opinion leaders and clinical champions for the product. And another important factor for our first-time CEO is the network of mentors he has built up. We often ask CEOs of startups to come for a fireside chat to share their experiences. Though these meetings and other contacts our management team, he's established relationships with more experienced CEOs to give him guidance on important issues like pricing models, sales cycles, and raising money. The incubator provided Antishock with the ability to reach out to an entire network of help that would not be available to a startup operating on its own. Now that we have looked at some specific challenges Antishock faced, let's look at some of the other ways we help companies reach out to the ecosystem and the market. We assist our companies and help in setting up co-development, partnerships, and clinical studies with leading US healthcare providers. We also help them find trusted advisors to guide them in regulatory strategy, reimbursement, and product engineering and other needs. We also help the companies reach out to the market for validation and to assess product market fit. And we also reach out to investors to present our portfolio. The incubator helps companies not by just reaching out to the ecosystem, but also with strong internal guidance in technology development and IP, in finance issues like budgeting and planning for future growth, in business development and marketing validation, and in developing skills for management and overcoming hurdles. As a result of these efforts to help companies get past the limitations of distance from the market, limited budget, a lack of information, and a lack of a network, we help them achieve technology de-risking, business de-risking, fundable milestones, and readiness for investment. Our goal is to prepare the companies well so that there's nowhere to go but up. These are our great portfolio companies with 3 more in the pipeline. We believe in them and we do our best to help them succeed. Thank you so much for your time. I will be happy to answer your questions in the Q&A session, and you feel free to reach out to me anytime. Thank you.